All right, we've got breaking news coming in right there. Let's get you the latest coming in. Prakash Javadekar has made a claim. Listen in to what he has to say. The breaking news is that Prakash Javadekar says vaccine is available for all above 45 from 1st of April. This is a big story that is coming in. There is no need of certificate of comorbidities. That is what Prakash Javadekar has said. So there you go. This is a big boost coming in for India's vaccination drive. The big story here is if you're above 45 years of age, from the 1st of April 2021, the vaccine is going to be available for all, and you needn't get a certificate of comorbidities to get your jab if you fall above 45 years age bracket. The vaccine will be available for all. I believe we've got a reaction coming in from Prakash Javadekar on this claim. Listen in. All right, we'll play that out in just about a bit. But Prakash Javadekar gone on to make a claim and has said that vaccine is going to be available for all above 45 years of age from 1st of April. This is a big boost coming in for the mass inoculation drive that India is conducting. There will not be a need for certificate of comorbidity for you to get this jab if you fall in the age bracket of above 45 years of age.
जो भी 45 के ऊपर है सब लोग अपना नाम रजिस्टर करें और अपॉइंटमेंट लेकर वो टीका लगाए, वैक्सीन करें। और एक और बात कहना चाहता हूं कि वैक्सीन पर्याप्त मात्रा में उपलब्ध है, उसकी चिंता करने की जरूरत नहीं है।
So that's the big breaking news coming in. I'm requesting the producers to patch our health correspondents, either Sneha Mordani or Milan Sharma, on this breaking story that is coming in. This is going to be a big shot in the arm coming in for India. This is Vaccination 3.0 we're talking about. Vaccine is going to be available for everybody above 45 years of age. This kickstarts from 1st of April 2021. Milan Sharma joins us live for the very latest on this. Milan, walk our viewers through this great news that is coming in for India's vaccination drive. It's a big boost indeed coming in. Questions now arising on what about the rest who are below 45 as well? What is the plan of action going forward?
Definitely, Chetty, it's a good news for all those above the age of 45. As in a cabinet decision, the government has opened vaccinations for all those above the age of 45 years. Now there is no need to show comorbidity certificates. All those who had to show these certificates were eligible under a criteria of comorbidities. That has completely been removed by the government right now. And it is a shot in the arm because a lot of people above 45 years of age who are healthy and don't have issues have been waiting to get the jab. This will be done from the 1st of April is what the government has announced. Yes, to your other question, Chetty, yes, the experts have been saying that vaccination should be open for all. But at this point, this is the first step that the government has taken towards opening vaccinations for at least those above 45 years of age, along with the 60 years of age who are already getting vaccinated. So definitely, it's a good news and a big news for the vaccination drive in the country.
Is there a big shift coming in the vaccination strategy, Milan, going forward?
Definitely, Chetty. The government was last week contemplating to put everybody in the vaccine criteria because we have to move towards expediting the speed of the vaccination. We currently are doing about 32 lakh doses per day, and that is the latest number that we have got. We have been breaching the 3 million mark, but the government also feels that in order to inoculate the priority groups before July, we'll need to step up the vaccination effort, which is why supply lines are being smoothened once again, and people who are eligible for vaccination are now being allowed to go to a hospital, private or government, and they no longer need to show at least a comorbidity certificate for those above the age of 45 years.
All right, Milan, stay with us right there. Listening to Prakash Javadekar once again.
जो भी 45 के ऊपर है सब लोग अपना नाम रजिस्टर करे और अपॉइंटमेंट लेकर वो टीका लगाए, वैक्सीन करे। और एक और बात कहना चाहता हूं कि वैक्सीन पर्याप्त मात्रा में उपलब्ध है, उसकी चिंता करने की जरूरत नहीं है।
Milan is still with us. Milan, India at the moment is battling the second wave of COVID-19 amidst vaccine skepticism as well, and hence there is also a need of the inoculation drive to really go ahead and expedite with the rising number of cases in India, especially in the worst impacted states like Maharashtra. Perhaps this is looking like a step in the right direction, but what about the vaccine skepticism, which is also a hard reality here in the country?
Well, Chetty, you're absolutely right. There still exists some sort of vaccine hesitancy, but the government by and large has been able to work towards doing away with it with the vaccinations that we are currently doing in India. We are using Covaxin, which is Bharat Biotech's, and Covishield, which is Oxford AstraZeneca and Serum Institute's. Recently, we've also heard from international studies that the AstraZeneca vaccine is safe as well as efficacious. So there seems to be no problem. The blood clot issue that came in firstly was also not found in India in any of the adverse events following immunization. And that is what an expert committee had also said to the government. So there seems to be no point for vaccine hesitancy, but there were a lot of people who were healthy, who were above the age of 45, who were asking the government to open the vaccinations for them. And now it's their chance to get inoculated. They will no longer need to show these certificates. So even on the COVID app, those who could not register above the age of 45 because they didn't have comorbid certificates will now be able to easily register or go for a walk-in at any private hospital or a government hospital and get the jab to increase the number of vaccinations in the country, which is the
Milan,
need of
do you
the
also
hour
feel that
with
the Indian
regards to-
government here is playing catch up? Because since 2 months ago, we had a couple of months ago, we had the vaccination drive that began, but the uptake was rather slow and there was a need for expediting this kind of uptake as well. And with, on the other side, the number of cases rising, of course, we need faster implementation of all that is being announced. So one is keenly really awaiting what next after this announcement too.
Yes, Chetty. In fact, not just the 45-year-olds, experts have been saying that anyone above the age of 18 should get the jab, and the government should open up all possible supply lines to not just give priority to those above the age of 45 and 60, but also those who are above the age of 18. But the Indian government has not really considered that as of now. It's happening in countries like the US, but not in India, because we also need to look at supply lines. India is also exporting a lot of vaccines, and the government has said it on record that we have sufficient supply of doses of both Covaxin as well as Covishield. We're also looking at other vaccinations that could soon get an emergency use authorization in the country. There's Zydus Cadila that's making a vaccine. There's Sputnik V, Russia's vaccine, that's also being made in India by Dr. Reddy's laboratories. So we have supply, but currently the priority groups are the ones that need to be vaccinated, Chetty, not just in India, but also in the rural areas of the country, especially where there is a surge in COVID-19 cases in states like Maharashtra, as well as Tamil Nadu, Kerala, and other such states like Punjab, that even Uttar Pradesh, that has only vaccinated about 2% of its population.
Also, what about the hotspots in the country? There have been 5 states that have been identified to be the worst impacted vis-a-vis the others in terms of the numbers as well. Is there any special plan for these states?
Well, Chetty, as we speak, the hotspots and the states that have been identified have already been told by the government to speed up the pace of vaccination. As I was just mentioning, Bihar has vaccinated only 2% of its population. Uttar Pradesh has vaccinated less than 2% of its population. Punjab is looking at peaks at this point, and Maharashtra is reporting a surge of cases of about 10% every day, which is why it's very important to inoculate people in the states like Maharashtra that also have COVID-19 variants from UK, South Africa, as well as Brazil, so that even if the disease is spreading, it should not be debilitating and save on ICU management and hospitalizations. Experts say that only if large amount of population is vaccinated will that be possible. And that is a possibility that the government is looking at right now to increase the pace of vaccination and vaccinate those who are necessarily willing and prioritized for the jab.
All right, leave it at that. Milan is getting us this big breaking story at the moment. If you're above 45 years of age in India, then you are eligible from 1st of April. You do not need a comorbidity certificate to go get your jab. With that, it's a short commercial break. Time now for a short commercial break. When we return, Dynasticracy with Paulami Saha and Akshara Nandagopal on the other side of the short commercial break.